Hey, hi everyone. Sorry we're a bit late. We have Dr. Yaffe and Dr. Williams here today. We'll go for a half an hour, one question, one follow-up, and I'll turn it over to the doctors now.
Yes, good afternoon, everyone. And it's our first time back on Monday without being here on the weekend. And as you're going to hear from Dr. Yaffe, it looks like the test results continue to go in a good direction. I'm not saying that's because we weren't here on the weekend, but it shows you that we're going to have some discussion on some of the trends. What does that mean, and what can we read into that and not read into that, and some aspects there. So this is really update of what happened over the weekend into today, and what are we looking at this week ahead of us as we come after it. And I hope everyone had a good Mother's Day celebration, whatever, in that line, because people did a lot of creative things. I was very impressed with what everybody did. It was cool, and for a lot of people, it was at a distance and a bit cooler than usual, but I think people did very well in that regard. So before we go into the reflections of the weekend, I'm going to ask Dr. Yaffe to talk about the numbers over that time.
Thanks very much. Good afternoon. First, I would like to acknowledge that it is National Nurses Week and thank all of the nurses in Ontario for your very hard work and dedication every day, and especially though during this crisis. So, as you know, this is our first update since Friday. We have seen some good trends over the weekend. On Saturday, we saw an increase of 346 cases, or 1.8% increase. On Sunday, we had an increase of only 294, which was an increase of 1.5% compared to the day before. And today, we have a total of 20,546 confirmed cases of COVID-19 reported in Ontario. This is an increase of 308 cases, or 1.5% increase compared to yesterday. 57.3% of our cases are in females. 43% are in people 60 years of age and older, and 61.8% are in people who reside in the Greater Toronto Area. 16.5%, or 3,407 of the cases are in healthcare workers. Again, this is a cumulative number. It does not reflect the number currently positive. We continue to see Ontarians recovering from COVID-19 with almost 74%, or 15,131 of our cases considered resolved. Currently, we have 1,027 people in hospital. Of those, 194 are in ICU, and of those in ICU, 147 are on a ventilator. And sadly, we continue to see deaths related to COVID-19. To date, 1,669 deaths have been reported, which represents an increase of 35 deaths from the previous report. With respect to long-term care homes, the Ministry of Long-Term Care is reporting 174 active outbreaks in long-term care homes, 1,235 deaths among residents, 4 deaths among staff. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 71 retirement homes are currently in outbreak, with 163 deaths reported among residents. With respect to lab testing, over the weekend, we saw a record high of tests completed in one day. On Saturday, 19,227 19,227 tests were completed, and on Sunday, 17,618 tests were completed. Today, a total of 13,970 tests were completed, bringing our grand total in Ontario to 447,964 tests have been completed. And we have currently 14,641 tests under investigation. I'll turn it back to Dr. Williams.
Thank you. And so we see the lab testing for today on the 11th, which is reported on the 10th, is 13,970. This would normally be the day when we dip down quite low every week. in there down to the mid-10s, which we've done before, and we haven't done that yet. So we'll see how that goes as the lab tests have their usual movement. And this is the cycle, and we're talking about the overall trends and directions with the lab testing trending up and the case positivity trending down as we're heading down to 3.5%. So we continue to drop and go lower. That is good news as well as the number of new outbreaks at the moment in the long-term care facilities has remained stable, as well as some other data points in that. The survey of the long-term care facilities is proceeding very well. We're getting well up above 50, going to 60%. So we are on full track to complete that by the end of this week, of having tested all the residents and as many of the staff as we can, which is a high number, which is also encouraging to see where that is going in that regard. There's still issues with the IMS table. There's working with the long-term care facilities, those that are having more difficulties with containment, as well as with staffing, HHR issues there, and well as working with the armed forces in the 5 institutions that they're currently involved with. So overall, a number of the data points are looking well. As far as the community versus long-term care on that side there, we're starting to segment that even more as we get along. And it looks like at the moment, some of the data is that the long-term care number tends to be slightly higher than the community number in that basis there, but it varies as we get the data completed. As I said before, we're always around that, where one's 45, the other's 55% and back and forth. So if you take that 308 number, that means we're somewhere in the community range around about 150, 140 to 160, somewhere in that range there. Not to be too exact because the data is still coming in. That is also encouraging as we look at our downward trending over the time there. And as we said at the end of last week, while we had some days of blips up and coming down again, this continues to move us in the overall direction of a downgoing trend of almost a week to 8 or 9 days. So we're anticipating whether we can really enter the next phase of the recovery one from the pandemic over to that one, and we'll getting some reports back from the public health measures table and discussing that with our command table to look at some ideas and directions. So in essence, going well. People are staying with the aspects of doing the distancing. They have some more challenges now as you're getting into the aspect of looking at retailers with more curbside. That means people are going to have to be more adherent to following some order and pattern there, discussing with the retailers so you're not too many crowding at the same time, keeping the distance, planning it out, calling ahead, scheduling things with each of the retailers as you feel the need to go there or not. And we're hoping to come up with some recommendations later on this week of the use of non-medical masks in the public settings and how that will be coming forward. We've been working with that also at our federal, provincial, territorial level meetings in that regard, as well as our overall testing strategy as we seek to continue to assess various populations and group in the province of Ontario for the prevalence, I would guess is the word, incidence of COVID-19 on a go-forward basis, so we're not missing anything. So with that, I'm glad you mentioned National Nurses Week because I have 3 nurses in immediate family, so I'm really responsible in that, and of course I'd want to recognize the valuable work of our nursing profession in the province throughout this time has been most valued and essential and critical as they stepped in the front line to take on those duties and responsibilities in that regard. So with that, I'm going to hand things over for questions.
Okay, we'll move to the phone lines.
Your first question comes from Kenyon Wallace with the Toronto Star. Please go ahead.
Hi, Dr. Williams. We spoke last week, at which point you said that when it comes to breaking down the numbers of cases between long-term care homes and those in the community, that it takes currently about anywhere between 5 and 7 days to confirm the proportion of cases in the community. And I'm wondering, is it still a 5 to 7 day delay? And if so, why is that? Or have we come down in terms of the reporting for community cases?
Mm-hmm. So we've been working diligently at how to improve so that the cases that are reported, when you talk about community cases, that means the lab result first from the community assessment center, where most of them tend to be done, as compared to the outbreak cases in the long-term care facilities. Those cases are, of course, go back to the assessment center, to the physician who ordered the test, to contact the individual and give them their results. At the same time, a copy should be going to the local public health unit where that person resides. And we've had a few cases where a person's gone to assessment center. They may be up there working temporarily, but their actual home residence is in another health unit. So that means there is some delay in getting that done. So that type of process, we found that now we're getting close to, across the province, near of 90% of the contacts, or the cases are contacted within the first 24 hours. That means moving the testing expeditiously into the health unit so it gets entered into the IFA system. So we're ramping that up even quicker on that basis. Part of the aspect of some delay is that sometimes the lab slip is not filled out completely. As a result, the contact information of the person may not be there. It takes a little bit more detective work to locate. It may be the wrong contact information. There may be other issues that, while it can't be 100%, but we're getting fairly close to there, because the idea is that if it's a lab test, you do want to talk to that person. You have to work hard at getting that, whether it's a language barrier, whether it's a phone call information, the person's not home. You still have to do it. And that may leave a delay, but you don't want to say, we're just not going to follow up on it. You are going to follow up on it. So that's why we're getting close to that mark, and we hope to be getting that detail out even in a more concise period of time, as we discussed on the phone.
Follow up?
Yeah, actually, you sort of answered my question there, but I was just wondering, when do you think you'll be able to start reporting the community numbers? Right now, we are getting reports every day on the ministry website of the number of cases in long-term care homes. Is there any time frame you see for when the community numbers might also be reported on that daily website update?
Yeah, we're moving towards putting that on. And so even today at our command table, we looked at some new data sources they've been going through with some nice colorful graphs and pictures on that shows the breakdown. And we're trying to get that moved over to actually being on our web page in that time there. So all things are moving ahead on that, and hopefully soon to give you that information on a daily basis.
Next question.
Your next question comes from Richard Warnica with the National Post. Please go ahead.
Hi, Dr. Williams. Can you hear me?
Go ahead.
Oh, hi. I've been speaking to clinicians, epidemiologists, people in the public health community about contact tracing. And every time I ask them, how is contact tracing going in Ontario, they kind of laugh and ask me if I find out to let them know. Can you just give a broad sense of how well set up are we in terms of contact tracing infrastructure in the province right now?
Yeah, well, Dr. Yaffe and both will answer that question. Is the contact tracing, when we checked it out, how many health units have contacted 100% of their people in the first 24 hours, 28 out of the 34 had done so in that regard. So most have. The challenge comes in with some of the health units that have the biggest caseload, as you can imagine, the large ones that we always see every day, Toronto Public Health, York and Peel, and Ottawa to some extent, where they're not dealing with just some health units have only about, some have had no cases for a while, some have had 2 or 3, sometimes in a day, but there where you're getting 100 to 110 a day, how well you handle that one there. So if you took an average across the province, most are at that stage and can do the case contact management in that regard. It's when you get into the larger ones centrally that we're trying to look at how to assist and work with that, as you would expect, to the ones that have the biggest load, and to follow those, because each case has a number of contacts to follow up and to deal with that regard. So whether you represent the health units in a partitioned way or as a collective, gives you a different picture. So I think we're getting very close to that, and especially as you see the numbers are dropping down. If you end up with 150 new community cases, even among the 4 larger ones, that would considerably diminish their number of new cases coming onto their table every day, and brings it much more into a reasonable area to work where you can devote your work on, as well as then when you take the task of doing the long-term care surveys off, gives you more staff time to devote to that as well. So a number of things are all moving in the right direction.
Maybe I could just add to that. I think it's important to remember that case and contact management for infections that are reportable is one of the core bread and butter things that public health units have done for forever. And so this is no different. This is very basic public health work. And Dr. Williams was talking about the follow-up around the cases done almost all within 90% plus within 24 hours. The contact follow-up data is currently not in IFIS, and that I think is maybe why when you speak to others they don't have the data, but we're very confident that the contact follow-up is being done. It's a priority. And in fact, Public Health Ontario has trained some federal staff to do contact follow-up and has offered that assistance to the health units. I think maybe one or two larger ones have taken up that offer. So we are very much making sure that this is a priority. Certainly as we go forward and start to loosen the measures, we want to make sure that all cases are contacted quickly and their contacts are followed up, because we want to nip it in the bud and make sure that the spread is cut, that it's not further spread into the community.
Follow up?
Yeah, could I just ask then, if we did see, let's say we start relaxing the restrictions a bit, if we saw an outbreak in a place that has not had significant caseload right now, how quickly could they ramp up their tracing capacity to make sure they could handle that kind of surge?
Well, you're talking about perhaps a health unit that hasn't had many cases. All the health units have redeployed staff to work on this, trained them, and as I mentioned, Public Health Ontario has trained staff as well that can be helped, not necessarily physically brought in, but can help. So, and we're, the offer is open to health units to, if they need more, to get more help on that. So, again, this would be a top priority and it would happen.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Dr. Williams. I might be asking you to step in a bit of a hornet's nest here, but I'm afraid there's some confusion over some comments the Premier made earlier today when he acknowledged he had his 4 daughters over for dinner. 2 of them don't live at home. They're in a different household. A lot of people are wondering if that is breaking the rules. Is it recommended that we have people from a different household over for dinner right now?
Well, I don't know the details about what went on in that situation there. I know some have cases where family members come over and they stand on the front lawn, or people come and they sit 6 feet apart and they do some visitation and things like that. Whether that's the type of modality in that, I don't know. I think we're trying to look at how to address and on our way forward, how to handle that on our way forward, and people can do that gathering. We have allowed that kind of distance gathering in that sense there. So whether someone's 6 feet away in different aspects, I don't know the details there. So, and again, I didn't hear a lot from what the Premier had shared in that event there. We're just asking people in general that you, with outside your unit, whatever that is you have, and some have an extended family within the unit, and there's all sorts of different definitions, that you can still have visitation. You're trying to represent that physical distancing in that sense there. Even if it's in the same geographical area, you still try to do that and to restrict that at that time. So that's our general recommendation at this time, and how that applied to the Premier's situation, I'm not sure.
Follow up?
Maybe I can ask it this way. So I have a sister who doesn't live very far away from me and her husband. Could I have had them over for dinner at the dining room table last night? Or is that breaking your recommendations?
Well, I mean, I would say how you do that and how you're going to maintain the 6 foot distance the whole time is going to be, you have to assess that and address that. So if we're asked later and there's our positive cases, did they expose you or vice versa? You'd have to say, was I in contact? And people tend to be lax on that, to say, no, I maintain that distance. Much like the same on the weekend, we had some of our family visit, but they sat on the front porch. They sat on the front lawn. We didn't have them within 6 feet in that. We respected that. They respected that. That was fine. A little difficult because you can't really hug the grandchildren, but you have to work that. And that's even the grandchildren, 2 and 4-year-olds, were very respectful of that and didn't do that. So it's how you maintain that, because if there is a case, how do we know if you didn't transmit within that area there, and you started to spread, as Dr. Yaffe alluded to, if you're doing case contact management? We want to be sure that you know, were you in close contact or not, and are you sure that you maintain that diligence during that period of time? So we're asking people to do their part to maintain the physical distancing at this stage, and then when we feel we have or are not low enough and the community transmission is down enough, like the numbers now, we might look at how to change that and to give some wider thing, because I think people are really wanting to have that kind of context in the near future. So I think you have to do your part in that and wait until you get further direction from us.
Next question.
Your next question comes from Sabrina Nanji with Queen's Park Today. Please go ahead.
Hi, doctors. I'm wondering, I wanted to ask you about Kawasaki disease, and I was wondering if there had been any cases or possible cases linked to COVID-19 in children in Ontario.
So we've been asking our experts on that, and review of the matters. We haven't any cases of the it's called multifocal vasculitis. That's a long term. Kawasaki is a certain subgroup of that some pediatricians feel is under some definition. They like the more wider term of the multi-site vasculitis and that kind of thing, or multifocal, which is the so-called COVID toes and that kind of aspect in there, because Kawasaki has a number of epidemiological causes or in that, other viruses, not just COVID-19. And some of the pediatricians are saying, we want to really understand, how does COVID-19 present in this way? They've never seen it before. And some are talking about a delayed effect. So lots of research is being done in that regard. We depend on our experts, like people at the Hospital for Sick Children and all our pediatricians in the province of Ontario, who are monitoring it very carefully and are trying to be clear. They can report it because it is, if they feel it's related to COVID-19, our case definition would allow them to report it in that regard. But we haven't collected any cases in Ontario yet. We know there are some in Montreal, and our counterparts here in Ontario are discussing it with their experts and their counterparts in Quebec and trying to be informed on the matter of this always new evolving science, as they say, in regards to COVID-19. So we don't have any yet in Ontario.
Follow up?
Okay, thank you. And I guess to follow up, it may or may not be related to that, but have any children been admitted to the ICU or hooked up to a ventilator?
I have not seen that reported to us yet. There are some cases, I understand, that have been seen in the Hospital for Sick Children's. As for other children around the province, we have not seen that data at this time. We've had no deaths reported to those under the age of 19 as of this time in Ontario. Doesn't mean we're on looking for it. We're not. We hope we don't see that in that situation there. So. No, we have not been notified of that by any of the hospital facilities as of this time.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, doctors. I just wanted to follow up on Cynthia's questions. I just want to be clear. Is your advice still that people should limit close contact to people only within their direct household?
Yes, that's been our recommendation, is that in your bubble, pod, whatever people call them, is that you've had this unit that you, whether it's an individual, a single person, or a couple, a partner, or a family, and some families have 3 or 4 or 5. There's a few of 6, I think, and so they try to do that. They go out together, they walk together with that one there, and we say that's okay because you have that group of 5 walking together. Outside of that, we have not yet opened that proviso up yet, and how that might work. And so that's what we've asked for so far, because at least we can say your contacts are limited within that scope, and therefore if there are cases, if one's positive, then we look at the other ones in that home setting, and we'd have to put them on observation as well as potential isolation until we had them tested and monitored and undertaken during this first wave of the pandemic phase. And then we have to look at, when we're now down getting low enough, can we go with something different for phase 2 or stage 1 of phase 2 in that regard. But that's where we are at the moment.
Follow up?
Yeah, and I also wanted to just ask you to clarify a little bit, or I guess elaborate on something you said earlier on in your remarks. You said that we're in an overall downward trend, and that by the weekend you're anticipating entering the next phase. Can you just elaborate on what you mean by that?
What I'm saying is that we had said before, if we saw a downward trend over a 2-week period, and that a number of other metrics such as positivity rate, things around the R0, that's that transmission keeps coming down, and a number of factors that the public health measures table could look at that and saying, all things considered, and with the case contact management, as Dr. Yaffe alluded to, that we feel is ramping up, and that the health units can deal with that, then we could look at entering, considering giving recommendations to enter the next phase, the so-called stage 1, because then, as Dr. Yaffe alluded to, if you have a case or a number of cases you're doing case contact management, it may not be that all of a sudden you have widespread community. You may found out that there was a community-type gathering against our recommendations that had spread among that group. So instead of having community spread very quickly on your case contact management, you have an outbreak within a group. You can contain that and control that and reassure the public it has not gone community-wide, because as you're changing, stepping down back from those public health measures, turning back the dial, if you may, the public want to be appraised and assured that no increased risk to the community has transpired in any stage when you're stepping back down, so you don't have to do a reversal and go back up again. So we said we would do stages, as we said, every 2 to 3 weeks we would hold on that, and then monitor to see, have we had any evidence of increased incidence and prevalence in community spread, yes or no. So that's the general context we laid out in the actual framework that we presented back 2 weeks ago, and we're following that plan, as we said, the overall plan, not the actual menu, but as the Premier and others said, our overall framework as we proceed.
Next question.
Your next question comes from Jack Hain with Queen's Park Briefing. Please go ahead.
Hi, Doctor. I just wanted to follow up on Cynthia and Allison's questions about the Premier and his daughters coming over. So you're saying your advice is still not to commingle with anyone outside of your direct household. The Premier said earlier that he trusts Ontarians' best judgment. Do you think this type of mixed messaging is adding to confusion for Ontarians?
I mean, our messaging all along has been, we've asked everyone to do their part on the physical distancing and that, and because at the time we're not sure if people are out around the community, could they be part of actually community contacts? We don't know in that. So we asked people to be vigilant and diligent in handling that and taking those precautions in that regard. Much like I said in an example of our situation where we did that, it wasn't the most comfortable. It was actually cold outside, but we still did that and did the 6-foot distancing, but had the visit in that. So we want to respect that in that regard and to give evidence of that in there. We know that there is some pent-up energy of people saying, okay, when are we going to be able to do much more socializing and that kind of stuff there? And so that's where we're looking at these numbers very carefully and wanting to be able to tell when and how public might be able to do that as we consider moving out of the pandemic phase into the next phase 2, and any staging. So we want to deal with that because we know the public want to address that, but at the same time the public want to be persuaded that we're not putting larger groups at risk and we don't have to do a reversal back up again. And I know the government and the Premier doesn't want to have to do that on the economic side as well. So I would say our message is still the same, and we're asking people to hold the fort for now, and we'll get back to you as soon as we can.
Follow up?
Well, I know that your messaging has been the same, but do you think it's a problem when your messaging in the premiers is different, even if it's slightly different in this case?
Again, I wasn't at the press conference, so I'm not sure what the messaging, I think, there was being responsible. I would say that's definitely true in there, and my concept is how you do that is important to follow the directions we've been giving in there as people undertake that. We know that sometimes people have, even in the busyness of going to stores and stuff, have come into close contact, and now that's why we've asked them at times that they would be wearing a face covering where they're unable to maintain that physical distance in that regard, and they may have to do something like that to have that occur, that they say, okay, they're in closer than the 6 feet for a period of time where they're wearing face mask or covering. There's all those other added things that people can do. Not that we wanted to say by wearing a face guard you can totally ignore the distancing. It's just that there may be a moment or time when you can't keep and maintain that one, and so therefore you want to use that extra protection of the face covering at this time until we're persuaded that the community prevalence of COVID is low enough that we can contain it, and to assure the public that we can start to do something different. And that's what our measures table is talking about, the next phase of responsibility in that regard.
Okay, we're going to move to the last reporter on the line.
Your next question comes from Taylor Simonens with CBC Toronto. Please go ahead.
Yeah, hi, thank you. Just to close the loop on that, I guess, I'm wondering what you need to see before we will be able to sort of double the bubble or have people over into our households, whether it's family or...
Well, as we said, we want to look at a number of things that tell us that the prevalence or the new cases arising in the community has continually dropped over a 2-week period. It's getting to a level low enough where we're back into where we have our case contact management system is able to absorb that, quickly assess that, rule in or rule out community spread, back to where we were, that our cases are no longer, we have quite a few at the moment, they're not sure where they got it from. In essence, if we know what your contacts are, then we can actually move quickly to contain it, as Dr. Yaffe alluded to. If you say, well, I just don't know, I can't recall, but we're hoping that now with our coming down this phase here, we should be able to say, well, you must know in the last number of days who you've been in contact with for periods of time closer than 6 feet. Who were they? Because not only we're concerned about you, we're concerned about them, and you should be concerned about them too, because if you're positive now, they need to be assessed as soon as possible to make sure that they're not positive, and anyone they may be in contact with could be spreading it further. So we want to limit that fairly quickly. So the metrics we're watching is case positivity, the R naught factor, which I won't go into detail explaining now, the drop in new cases reported every day, continually coming down in the community side, and aspects related to case contact management to make sure we're back into that containment type modality in that. So all things are, as I said, are moving in the right direction at this time as Ontarians continue to do their part in being vigilant and being steadfast in their management of this. So stay tuned.
Okay, follow-up, and this is the last question.
Okay, and just on a different topic, we also heard the Premier say today that the government is close to a decision about the remainder of the school year. At this point, are you advising that schools remain closed or open up?
At this time, we are planning to have some more discussions with the Ministry of Education. We usually have that on a weekly basis. We haven't had that this week, so we'll be sitting down with them because they have a number of metrics they're measuring. We have our data we're looking at, and we want to look at the two and see how that might work. And with all the information we're getting from other sectors and that, what we would recommend with them. So we haven't made a definitive decision yet, a recommendation, as we haven't had our meeting yet with the Ministry of Education, which we're hoping to have shortly this week.
Thanks, everyone.